The President. Good morning. Let's resume the motion debate on shortening the waiting time for specialist outpatient services at public hospitals. This debate will go on until 10:10. So members, if you want to speak, please press the request to speak button. Mr. Tommy Cheung. Thank you, Mr. President. I thank Mr. Edward Leung for moving the original motion. The Liberal Party has all along been urging the government to step up public-private partnership programs. Since the last term of government, until this PA consultation meeting with the chief executive, we have been making the same request because patients with means can be triaged to receive care in private healthcare sector. One example is the cataract surgeries program. This is one of the most successful PPPs. And we also welcome the new initiative in the policy address, that is the government will provide subsidy for patients with hypertension and diabetes to receive care in the primary care setting. I reckon that if this is deemed successful, the initiative will be further expanded to cover other areas. I support that, and I also support Mr. Lee's amendment to admit more qualified specialist doctors and nurses to practice in Hong Kong to shorten the waiting time at public hospitals. The government has been deploying a lot of resources on healthcare, and in the last term of government, some $200–300 billion have been set aside to increase hardware for hospitals. Now, after a long wait for a specialist consultation, if we wait for only 1 or 2 years before we finally receive the necessary surgery, it would be a good deed. But the wait is still too long. If we have shortage of manpower, the problem remains. We have only 1.9 doctors per 1,000 in our population, comparing to OECD's 3.4 doctors per 1,000 population, or 2.4 doctors in Singapore. We are on the low side. As for China, according to the 14th five-year plan, they seek to increase the ratio to 2.9 to 3.2 doctors per 1,000 population. Recently, we have had the brain drain in the healthcare sector, leading to an even lower ratio. In the 90s, Commonwealth doctors could be admitted to practice in Hong Kong. The shortage at public hospitals was not as severe. At that time, patients would prefer public hospitals. But times have changed. We have several hundred graduates joining the workforce in every year. And yet, this is not enough to resolve the shortage issue. We need to admit overseas doctors. As far as this roadmap is concerned, the Liberal Party has been striving to admit more doctors. We once tried to table a private member's bill to remove the obstacle. In particular, something should be done about the Medical Council of Hong Kong so as to address the issue of protectionism in the profession. Eventually, the government took the initiative to amend the medical registration ordinance to allow more doctors, non-locally trained doctors, to practice in Hong Kong. However, Section 14F has not been interpreted correctly, such that medical graduates trained using Chinese as the medium of instruction cannot practice in Hong Kong. We'd like to further expand the scope apart from expanding the list of recognized academic qualifications overseas. Those in teaching hospitals should enjoy the same eligibility under the special registration avenue. It is absurd that mentees could be registered but not the mentors. For non-Hong Kong permanent residents working or studying in these teaching institutions, as long as they are of caliber, they should be allowed to take the special registration route. Be it general or specialists, general physicians or specialists, they should be allowed to practice in both the public and private sectors. We have an aging population in Hong Kong. Definitely, the problem will further exacerbate as we have more patients rushing to public hospitals. We need to admit more overseas doctors. Dr. Priscilla Leung. Mr. President, this is a timely debate, and I thank Mr. Edward Leung for moving the original motion. Shortening the waiting time for specialist outpatient services at public hospitals is common aspiration. In 2008, when I first joined the Legislative Council, every year I said the same. For the budget and for the policy address, the government should invest $10 billion every year into healthcare, and Dr. Chun-keung allocated $200 billion for the 10-year hospital development plan when he was chief. Since 2008, we have been striving for the establishment of a children's hospital. We finally have one in Kai Tak. So the government has made a lot of effort. We have a very good public health care system in Hong Kong. However, when it comes to specialist outpatient clinics, this is really a pain in the neck. The chief executive proposes in the policy address that the waiting time for the specialty of medicine should be reduced by 20%, and in different clusters for the specialty of eye, the waiting time could be 164 weeks, 138 weeks, and for orthopedics, 100 weeks in the Hong Kong cluster. And I know from friends that they need to wait for 3 to 5 years, and even for diabetic patients, they need to wait for 10 months before getting a shot, an insulin shot. The government is looking squarely at this issue. According to statistics, for SOPCs, they take only one new case for every 9 old cases. So I definitely support more effort on developing family medicine. Say for Dr. Tong Shiu-fai and another doctor, over the years, they have been telling me that for the specialty of eye, to treat cataract patients, etc. Many eye doctors would like to join the PPPs. As for dentistry, there was a collaboration. It was very popular in Sham Shui Po. There was collaboration between the Dentist Association and the community. We mobilized community resources to run mobile medical vans to provide dental service. By 2034, 30% of our population will be aged 65 or above. So in other words, those aged 53 or above should get ready now. According to my friends, when they retire at 60, they won't be able to afford hefty insurance policies. So they are queuing up for the public hospitals already. As I said in the outset, we have a good public healthcare system. But have you considered the capacity issue? We need to remove obstacles to admit more non-locally trained doctors. Otherwise, the public hospitals will be bursting at the seams. We may not have sufficient hospitals, and we may not be able to pay for the doctors unless you substantially improve primary health care in terms of the number of hospitals, the facilities in these hospitals, and the newly trained local doctors from the universities. This is the major source of manpower in the healthcare profession. I once mentioned that for doctors performing well overseas, they should be admitted to practice in Hong Kong. And for some courses, when I said that those taught in Chinese should be admitted, Mary Ma from Hong Kong from SEMP immediately criticized me. By 2034, when we are in severe shortage of manpower, facilities, and hospitals, when we have a surge of patients in public hospitals, there is no way out. I hope that we can set our political differences aside.
主席，本人發言支持梁。
Mr. Frankie Ngan, President, I speak in support of the original motion. For SOPC services in public hospital, the waiting time is very long. It is a well-known problem. The latest, according to the latest waiting timetable for Kowloon East, the medicine waiting time is 117 weeks. The chief executive promises to reduce the waiting time by 20% for SOPC services to tackle the problem at root. In the past, our medical system has focused too much on treatment rather than prevention. There is a long-standing insufficiency of family doctors. After years of exploration, public-private collaboration is still not popular. Members of the public as a whole lack understanding in terms of prevention of disease. The private sector charges a high cost for treatment. In terms of emergency, patients can only seek help from public hospital, and the government is not doing the gatekeeping job properly. The policy address proposed the establishment of the Primary Healthcare Authority for coordinating the medical services. With the advance of the authority, we can push the defense line forward to reduce the number of patients requiring urgent treatment, to reduce the pressure on public healthcare system. It is the right direction. With the aging population, there are more chronic patients. The pressure is ever higher. The government has to devise a way to turn around the previous wrong focus on treatment rather than prevention. On PPP, the PA proposed a 3-year chronic disease co-care pilot scheme from 2023 onwards. Eligible patients can have half of their treatments and consultation costs subsidized. It will be useful for referring stable new cases from the public healthcare system to the private healthcare system. It will help to alleviate the pressure on public healthcare system. However, we are worried that there would be a lackluster response from family doctors. And only paying for half the cost may not be attractive enough for grassroots patients. The government may have to enhance the plan to attract more patients to seek help from the private medical sector. I thank the Chief Executive for taking on board the DAB's suggestion to extend the coverage of healthcare vouchers to spouses, as well as supporting the purchase of hearing aid and so on. And the enhanced healthcare voucher package to $500 is also a good policy. Now, we should offer more choices to patients. We should adopt the money follow patients principle. For every family, for each adult, healthcare vouchers of $1,000 should be given. For children, the amount should be $2,000, and the amount of the healthcare vouchers should be shareable among family members. We should establish a system where patients can choose the family doctors they want. Our healthcare system has always been overburdened. Under the epidemic, the situation exacerbates. It shouldn't be just a slogan that we should improve primary healthcare system. It should be the actual direction of the government. Now, the healthcare voucher system has been an efficient policy tool for many years. The government should consider enhancing the healthcare voucher scheme, enhancing PPP, and subsidize families to see family doctors so as to alleviate the pressure on public healthcare system as well as grassroots families and medical expenses. Thank you. Ms. Eunice Yong. President, I speak in support of Mr. Edward Leung's original motion and all the amendments. President, the LegCo would regularly discuss the problem of long waiting time for SOPC services in public hospitals. The issue has been long-standing. According to the waiting time for stable new case booking at specialist outpatient clinics between the 1st of July 2021 to 2022, besides the 48 weeks waiting time for pediatrics departments, for the other specialist departments, the waiting time is 100 weeks. For Kowloon West, the eye department's waiting time is 173 weeks. That is equivalent to over 3 years. Last year, the longest waiting time for the eye department belongs to the Kowloon Central cluster. That is 138 weeks. So the situation has even exacerbated. In terms of PRH waiting time, the government has set a cap for the waiting time for PRH applicants from 6 years to 4.5 years. That's the target. For waiting time for specialist outpatient clinics, there is no clear target. Now, the target is to reduce the waiting time for SOPC stable new cases by 20% by year 2034. For other departments beyond medicine, where there is no KPIs. I'm disappointed. I think we should set a target in terms of the median waiting time for the other specialist services. Now, the HA will adopt a multi-pronged approach to reallocate resources to deal with stable new cases and also rationalize the referral arrangements and also offer cross-cluster support. Of course, I support these measures. Yes, the government has to give us more details on how the goals would be achieved. Say, for example, enhancing resources. Through the first 10-year hospital projects, the government will increase some 4,600 hospital beds and 80 operating theaters in the next 5 years. There is a clear roadmap, and we should support it. But the crux of the problem is manpower. Last month, the HA said that the wastage rate for doctors last year was 8.3%. For nurses, it was 10%. And the wastage situation would continue to be on the rise. According to the manpower projection 2020, by year 2040, there will be a shortage of 1,900 doctors in Hong Kong. Last year, we passed the Medical Registration Amendments Bill 2021 to attract eligible non-locally trained doctors to come to Hong Kong to practice. But this is just a drop in the bucket. In the long run, if the government cannot retain healthcare professionals, no matter how many hospital beds we can, the problem will not be resolved. Under the PA, there is a requirement for there is a requirement in terms of number of years for dentists and specialist doctors to serve in the public sectors. But there is no clear timetable, and we don't know how effective the plan will be. The government has to pick up pace and learn and draw reference from the epidemic to make more accurate forecasts and estimation on manpower demand to cope with the rising need. Now, we also urge the government to put more focus on the development of Chinese medicine industry. There are already a number of Chinese medicine practitioners in Hong Kong. If we can draw the help, we can alleviate the pressure on the public healthcare system in the short run. I welcome the policies mentioned in the PA concerning Chinese medicine. That is the Commissioner for Chinese Medicine, the Chinese Medicine Development Blueprint, and also subsidizing the training of Chinese medicine doctors to 80,000. By enhancing Chinese medicine services, we can convince the public to choose Chinese medicine as a course of treatment and prevention to alleviate the pressure on public healthcare system. I support the Western Chinese medicine collaboration between both disciplines and play their complementary streams. In the long run, we should enhance the hardware and enhance the manpower to cut the waiting time. Thank you so much. Mr. Bill Tang. Thank you, President. Now, I'm pleased to see this motion moved by Mr. Edward Leung. I think all members in the Council are concerned about the problem. However, I'm worried about the PPP model. Private hospitals may pay better for doctors, and there is a less administrative cost for administrative burden for doctors. If we put too much emphasis on PPP, then more doctors may join the private sector, and it may exacerbate the public healthcare manpower shortage. So after all, the solution is simple: increase the number of doctors and decrease the number of patients. Now, in terms of increasing the number of doctors, why do we have only 2 medical schools? Can the government immediately plan to build a 3rd medical school in, say, Sai Kung? So why do I mention Sai Kung? Because that is the Kowloon East cluster. There is a serious problem in Kowloon East cluster. The population is aging, so among the 8 clusters, the waiting time in Kowloon East is the worst. So can we draw reference from the Chinese University Medical Center to establish a self-financing but non-profiteering hospital to serve the public? So my question is, why do we only have 2 medical schools? Can we have a 3rd? Now, among the 8 universities, the HKU and the Chinese University are offering medical courses in Shenzhen. However, they are ensuring the quality of the courses by ensuring that the courses are fully in line with those offered in Hong Kong. That may be a viable option. And also, we may waive the tuition fees for medical students. In exchange, students have to promise to serve 10 years in public healthcare sector. The FTU is urging the government to allow the usage of healthcare vouchers to take out insurance policy in the mainland. So can we nurture, can we encourage Hong Kong residents to seek medical help in the mainland from Hong Kong institutions? And also, then there is alternative other than registered Western doctors in Hong Kong. I mean, there are Chinese medicine practitioners, and they are also a good option. Now, Chinese medicine practitioners can refer patients to a physiotherapist. The same concepts can be adopted. Now, for NAD, the referral to physiotherapist is half a year. Now, for work injury, the waiting time is shorter. For normal cases, they would have to wait for half a year. So why don't we allow these patients to seek help from a physiotherapist directly rather than waiting? So it is dropping a stone on our feet. So ultimately, we have to ensure that patients won't think of doctors immediately when they want to care for their health. There should be help available from other professionals. Say Chinese medicine practitioners should be allowed to offer services like radiology and other checks. Referral to physiotherapists, and there is only talk and there is no timetable. The system is asking the patients to seek help from public hospitals directly. So like land creation and housing supply, we need to adopt a multi-pronged approach, increase the number of doctors, reduce the number of patients, and you don't have to seek help from a doctor immediately. So I also suggest the science, the HAUST established a medical school. Thank you.
Mr. Frankie Yik. President, I'm grateful to Mr. LEUNG for moving this motion. According to the HA Kowloon West ophthalmology, a new case would take 3 years, 2 months. Hong Kong West, 2.5 years. This long waiting time is really causing a lot of pain and suffering to the patients, and some of the less serious cases will degenerate into serious cases. I'm glad to see that in the policy address in 23-24, the medicine specialty, the stable new case waiting time will be reduced by 25%. And it would shorten the period by about 2 months, but if this can get off the ground, it would be a quick step forward. I think we need to adopt a multi-pronged approach. In the original motion, it proposes the expansion of the PPP, and also there is the proposal to have the primary care and also the strengthening of the primary network. I support that. And Mr. Chun-keung also proposes the specialist primary health care network. That the Hong Kong public hospitals are hamstrung by lack of manpower. According to our Hong Kong Foundation's report in 2019, the doctor-patient ratio is 1.9 per 1,000. It is lower than OECD's 3.4 and also 2.4 in Singapore. What's even more serious is COVID hit Hong Kong 2 years ago, and there is an upsurge in the number of patients after the Black Hat violence. There is a mass exodus from the healthcare sector. The ratio is getting more serious. Hong Kong is witnessing an aging population. The public doctors will have to serve more doctors, and the crisis is getting worse. So in the light of this, I think it's right to import qualified teachers, doctors and nurses from outside. It is only right and proper. I'm glad that the administration has taken on board the Liberal Party's proposal to introduce qualified, non-locally trained doctors to Hong Kong. After the legislative amendments, there are still inadequacies. The Medical Council set up a special registration committee. It only recognizes the courses that are taught in English, and some doctors are deterred from coming to Hong Kong, and the teachers of these doctors may be more experienced, but because of the wordings of the legislation, we simply cannot lure them to Hong Kong. So we urge the administration to deal with these issues. Some said that the healthcare quality has deteriorated compared with 10 years ago. 90% of the people are using public healthcare system, and the waiting time for the special outpatient clinic is in terms of years, and it is undesirable. So shortening the waiting time is the first order of importance. So we have to improve the healthcare service, and the SL government should open the door to more specialist doctors and nurses to come and practice in Hong Kong, in particular from the mainland. And they can make a contribution to Hong Kong going forward. I support the motion and all the motions as amended. Dr. Chow Wen Kwong, Mr. Chen Pui Leung. President, the waiting time of the SOPC is very, very long, and it's getting serious. According to the HA, the stable new case, and let's take a medical specialty, for instance, it would take 2 years. Hong Kong West, 2.5 years. Ophthalmology is also pretty serious. Kowloon West, they have to wait more than 3 years. The HA's SOPC, there is an attendance of 7.7 billion, and the new case, the number stands at 850,000 per year, and only 790,000 would get to see the doctor, and there is a backlog of old and new cases at a ratio of 1 to 9, and people are not able to get proper treatment before deterioration. The HA has introduced a whole raft of measures to ease the pressure, like they get a priority right, they get locum doctors, they optimize the appointment system, but it is not going far enough to achieve good effect. Why is it that SOPC is under such tremendous pressure? I think it's because the public hospitals or public healthcare system is taking the majority of the cases that could otherwise be diverted to the private sector. The public healthcare system is responsible for checking, examination, and treatment, and people can enjoy a whole series of services for $100 or dollars. They are taking up 90% of the medical needs in Hong Kong. People don't really consider whether their cases are serious, and they would just go to the public health care system. Given the manpower shortfall and the high medical costs and aging population, the number of chronically ill patients is on the rise. All these factors will only compound and exacerbate the services, the problem. SOPC is under increasing pressure. The waiting time and the caseload are increasing. The system is bursting at the seam. So in light of this, I think it's only right to divert some of the stable patients to the private care, and we should also expand the PPP. It's only with these measures that we can alleviate the problem. But the thing is, are we able to rationalize the positioning of the HA? Would there be sufficient incentive to divert some of the patients to private care? Last week, in the policy address, more resources will be devoted to rationalize the referral system. There will be integrated clinics to be created in order to shorten the SOPC's waiting time. In the next year, a medical specialty, the stable case waiting time should be reduced by 20%. I support this KPI and also urge the administration to incentivize patients to opt for private care. Healthcare voucher for the elderly, and this is a good measure to promote PPP. The elderly people are encouraged to choose the care of their own choice. I think the specialty SOPC can also be subject to the healthcare voucher scheme so that we can free up the resources for more urgent patients. Other than means tests, the government can also consider the setting up the KPI for the median waiting time for the stable case for the SOPC. If there is an exceedingly long waiting time, some of the patients on the waiting list can be diverted to the private care. For medicine orthopedics, the government introduced similar measure. The government make up for the differential for the stable patients to be diverted to the private sector. The government should review the effectiveness of these measures and apply these to all the specialties to make sure that we will have a system where money follows the patients. With these words, I support the original motion. Ms. Maggie Chen. President, I thank Mr. LEUNG for moving this motion to shorten the waiting time of the SOPC. I support the motion. I'd also like to take this opportunity to make some suggestions, and I hope that with concerted efforts, the government will be able to help the needy patients and also shorten the waiting time at the SOPCs and also to follow up on their cases. The waiting time for the SOPC has been exceedingly long. This is a perennial problem. I think the problem lies with the fact that this is only the only choice for the grassroots patients. On the other hand, for private healthcare system, in terms of surgery and so on, it is prohibitively expensive. People who have small means will not have an option. They still have to wait and wait for the public healthcare system. The waiting time is so long that the stable patients may get worse in their conditions. They may miss the opportune time for treatment. And as a result, the patients may not be able to control their conditions before they get worse. So I think that to improve the SOPC and also to improve the turnover is of utmost importance. In his motion, Mr. Leung said that the government should expand the PPP to cover more specialties. That much I agree. With the PPP, I think we can divert some of the patients to the private care. I'd like to mention some of the rare diseases. At the moment, the public healthcare sector has room for improvement for the treatment of rare diseases. Some of the patients, because these involve many different symptoms, will be sent to different specialties for treatment, and this is compounding the burden on different specialties. And the patients will not be able to get focused care, and they have to be running around, going to different specialties for treatment. I think the government should set up a data bank for rare diseases to enhance the availability of information of rare diseases. That can improve the care for the patients. This will also enable us to review the manpower needed for treating the rare diseases. So in terms of setting up a data bank, the government should take the lead. It should collect the conditions, the medication, and the treatment of the rare disease sufferers. And through the e-health system, the public doctors and the research teams will be able to get to grips with the conditions of the rare disease patients, and that will enable them to make connection with the patients. As to the treatment modalities, the medication, the clinical experiments, there would be good and accurate information available for use. Other than collecting the information there, I would recommend that the HA provide focused treatment system. They should put together the concentrated and focused care for these patients and assess the effectiveness and efficacy of the medication. And there should be a one-stop treatment for the patients in order to avoid any duplicated consultation at different specialties, and they don't have to run around for the service. And the government would also be able to build up a more experienced team. At Hong Kong U, the clinical, pediatric, and adolescent team, they are experimenting this treatment model, and I hope that the HA will try to explore the effectiveness of this focused treatment. If this proves to be successful, it should be expanded to other specialties. The collaboration between the Chinese and Western medicine is also important. I'd like to see this expanded further, and the rare disease sufferers can also enjoy this kind of service. Thank you.
You.
Mr. Benson Look. Thank you, President. First of all, I'd like to thank Mr. Edward Leung for moving the original motion, and I also thank the three amenders for their amendments. I'd like to take this opportunity to thank practitioners who are serving in the public sector. Currently, for a specialist outpatient clinic, the waiting time is very long. As at the 30th of June, according to the hospital authority, the longest waiting time, I'm sure, is Kowloon West Cluster. Ophthalmology, they have to wait for 3 years and 4 months. That is, for a new case, they will have to wait for half term of this government before they get to see a doctor. For other specialist discipline, the waiting time is equally long. For medicine, NT East, over 2 years. Kowloon Center, orthopedics, 2 years, 3 months. Mostly you have to wait for over 2 years. That is not ideal. Members of the public told me that the most effective way is to have a very long life if you want to get to see a doctor at a specialist outpatient clinic. Is it really the case? I'm sure that the secretary is equally saddened by like us. Well, President Xi said on the 1st of July, saying that when people need something, we should respond to that. And in the policy address, in one of the paragraphs, it says that in 2023, that is the next year, the waiting time of stable new case bookings of specialty of medicine should be reduced by 20%. But should it be limited to medicine? I think the KPI of the government should set the waiting time to be kept at 2 years for all specialties, so that patients will see the future. In the policy address, there is a mention of a multi-pronged approach. Well, can they reduce the number of old cases and specialties to make room for new cases? Currently, for new and old cases is 1 to 9. I think that old cases can be transferred to primary healthcare system so that resources can be better used. In paragraph 82 of the policy address, it says that in 2024, there will be the primary healthcare authority set up, and there will be territory-wide district health centers. We are a Chinese society. Chinese medicine practitioners play a very important role. If we're talking about multi-pronged approach, I think the involvement of Chinese medicine practitioners in the public healthcare sector, in particular primary healthcare system, is an important part, and it will be very effective. Paragraph 85 of the policy address says that for 200,000 quotas in outpatient for Chinese medicine, there will be collaboration with Western medicine. They will also actively explore other areas as well. So I believe that in order to enhance collaboration between Western and Chinese medicine, we need to promote the development of Chinese medicine. This sector has given us a number of suggestions. I will boil them down to 3 points. First, to incorporate Chinese medicine into the public healthcare system so that patients can choose to use Chinese medicine practitioners for their treatment. Secondly, to improve the registration system for Chinese medicine practitioners. On the mainland and in Macau, there is a registration system for Chinese medicine pharmacists. The government should look into this area to implement a similar system. Thirdly, to expand the room for PPP. Public organizations can make use of collaboration with the private sector to alleviate the pressure they face. So I hope the government will continue to use the multi-pronged approach to shorten waiting time of specialties in public hospitals. I support the original motion and the amendments. Mr. Yang Wing-kit, I agree with the original motion. We all know what the problems we face are. We have to wait for a very long time. According to the HA, for the KPI they have announced, for various specialties, ENT, eye, medicine, pediatrics, they have to wait for a very long time. But for the longest case, you have to wait for 3.3 years, 3.8 years, and for CT scan is 4.5 years in waiting. For replacement of joints, you will have to wait for another 16 months. That means you have to wait for 6 years. For NT-West cluster, you will have to wait for 8.5 years. But for eye, ENT, and medicine in London, you have to wait for 4 months. The longest you have to wait is 8.5 years. In Canada, you have to wait for 5 months. For replacement of joint in the UK, 5 weeks, Canada, 40 weeks. So you only have to wait for 2 years to get an operation. I don't think there are any other places that in which you have to wait for as long as in Hong Kong. Well, you need to have a goal. I have high expectations of the Health Bureau. They should set a ratio for the number of doctors per 1,000 people. They also have to set a target for waiting time. In the policy address, they only set the KPI for medicine. What about other specialties? Is it really grand that they can reduce waiting time for medicine by 20%? That means it's only a reduction of 2.7 years to 2 years. Is that reasonable? If you want to get an operation, you have to wait for easily several years. It's the norm, but the norm should not be the case. There is limited resources in the public healthcare system. Practitioners are having a hard time too. There is no sustainable development. If we have an increase in manpower supply, there is an improvement, at least in the work environment of practitioners. It will reduce the wastage in the public sector. The first and foremost problem to address is manpower shortage. We only have 2 doctors per 1,000 people in Hong Kong. Compared to other advanced economies, we seriously lag behind. If we have to catch up with Singapore and Japan, 2.5 doctors, we need at least 3,000 doctors. If we have to catch up with OECD countries, 3.5 doctors, then we need another 10,000 doctors. What's our target? You need to have a target. And then you can use the special registration to catch up. Well, you should relax the requirement of using English as the medium of instruction. You should introduce non-locally trained doctors. Next year there will be at least 70 doctors coming to Hong Kong. But we only have 10 quotas for doctors, and currently only 8 have signed up. You need to expand the quota under the exchange program. In order to address the problem of long waiting time, you need to have overall policies and detailed initiatives. The development of primary healthcare is important. I support the primary healthcare blueprint, and I also support the chronic illness co-care pilot scheme. Under the new initiatives, the DHC and DHC Express will need to fully tap into their function. The government should also think outside the box. PPP should be expanded to the GBA. The government talks about integration into the GBA. We need to leverage on the advantages of the GBA to address our inadequacies. For Grade A Hong Kong-funded hospitals, subsidies should be provided for them to provide services so that chronically ill patients can use the services there. So you need to be bold when it comes to implementation of policies to reduce waiting time. I will certainly support you. I hope that we will catch up with other countries. I so submit. Mr. Chun-keung Pan. Good morning, President. I thank Mr. Edward Leung for moving this motion. We have talked about this issue on other occasions in the past, but because of the chaotic situation, we were unable to address the problem. This is a very good opportunity for us to review our work and to find a solution. We now have a very able secretary to help us resolve the problem. We have long waiting time. I hope that there should be a review and streamlining of processes. Sometimes the waiting time is long. It may not be because of a shortage in manpower. It may be something to do with the process. We need a review. Let's look at the manpower supply in the public sector and the private sector. The workload between the two sectors are not that different. But how come that the manpower capacity in the public sector cannot cope with demand? That's because of cumbersome processes. They have to stick to the established mechanism because that's a safe way. Can we improve this mechanism? If we could improve this mechanism, then we are able to release some manpower to do other things. The process of a general practitioner becoming a specialist is cumbersome. And patients, if they have to go from general practice to specialty, they have to go through a long process. This should be streamlined. We should take a look at every process to make things more efficient. And the transfer of cases from general practice to specialty takes time. For someone going to a GP, perhaps it's just pain in all over the body, and then you get transferred to a specialty. That is like a mechanical process. So once the case is transferred to the specialty, it's off your hands. But we can do a lot of tests. Say, for example, for the same patient complaining about the same ailments, perhaps an experienced GP could attend to the case. It may be a rare disease. We don't have many experienced GPs at the front line. So the cause of the problem of many of the cases are not found. And patients have to wait for about 100 weeks. GPs can order tests, but more often than not, patients are made to wait, and it's often too late when they get to see a specialist. So we need to review the process. We want to avoid unnecessary transfer, but when a case needs transfer to specialty, it should be done. Well, the hospital authority is scared of a good work environment in the private sector because the colleagues will go from the public sector to the private sector. But if the work environment in the public sector is good, people won't leave because there are always risks in the private sector. A review should be undertaken to see what the work procedure is and whether there is a favorable culture to retain talents. Well, PPP can help a lot of patients, so it should not be something that they're scared of.
Mr. Dominic Lee, the waiting time in public hospitals is so long. Say, for Prince of Wales Hospital in my constituency, let me take this as an example. The waiting time for ENT is close to 2 years, for orthopedics even longer, close to 3 years. So I thank Mr. Edward Leung for moving this motion on shortening the waiting time for specialist outpatient services at public hospitals, so that this council has an opportunity to debate on the issue and for members to put forward our suggestions. The New People's Party will support the motion. In order to shorten the waiting time, a multi-pronged approach is needed. First, we need to speed up the construction of public hospitals. But more importantly, we need to admit more non-locally trained doctors and nurses to practice in public hospitals. In the mainland, for the elite courses taught using Chinese as a medium of instruction, we need to give recognition. We must not confine ourselves to English-taught courses. In the short term, we need to solve the issue as well. The Honourable Member, Mr. Lai, referred to the district health centres with low utilization yesterday. We need to optimize the use of DHCs and optimize the use of resources. I remember 2 months ago, there was a rebound of a number of infections in Hong Kong, posing a great pressure on our local system. At the press conference on the 26th of August, Professor Chun-keung spent 5 minutes explaining the situation. He explained that public hospitals provide services to 90% of all patients in Hong Kong. At the moment, 364 hospital beds were provided by private hospitals, but at the end of the day, some 202 beds were occupied instead of full occupation. And for 3 other hospitals, the utilization was 0. It means they never took in any COVID patients. Professor Low made a very valid point at the time. We do have private hospitals. They have manpower, they have land, but all the resources actually come from the community. So private hospitals should make a greater contribution to the healthcare sector in Hong Kong. On the 31st of August, the situation improved, and the Health Bureau explained that basically the procedure for receiving patients had sped up, and now 380 hospital beds from the private sector could be mobilized, alleviating the pressure on public hospitals. So there was not a repeat of patients having to wait outside hospitals against a cold weather in the peak of the 5th wave. That shows the effectiveness of deploying resources from the private hospitals. So it's not about the lack of resources, it's about the optimal use of these resources. Sometimes incentives should be provided. Like what happened last time, the government should exert pressure on them. Since the new term of government assumed office, we have seen improvement, and in this year's policy address, the government proposes to step up public-private partnership programs. We should give the government a round of applause. I hope that we'll continue to coordinate resources between the public and private hospitals so that more patients from public hospitals can be triaged to the private sector. We should optimize the use of district health centers, and more importantly, we need to admit non-locally trained doctors and nurses, and more importantly, the elite medical courses taught in Chinese should be given due recognition to alleviate pressure on our public health care. Mr. Gary Chen. Thank you, Mr. President. Mr. Edward Leung's motion focuses on the waiting time in public hospitals, but what is more important, stemming from this motion, is how we coordinate private and public healthcare resources so that we can better serve the public. We know, or it's common refrain, that the waiting time for specialist outpatient services at public hospitals is excessively long. For patients who can't wait, they must fork out money in order to visit a private doctor. But for grassroots patients, it's a non-option because it costs $1,000 or even several $1,000s to visit a private specialist. It's beyond the affordability of ordinary citizens. Instead, the grassroots are forced to wait and be tortured by their ailments. This is the reality for many patients. Hong Kong is an advanced economy. The situation is akin to having caged homes and subdivided units in such a wealthy society. It's unacceptable. The government has always propose to deploy more resources to healthcare, and some efforts have been made, such as admitting non-locally trained doctors, nurses, or increasing the training places. But the problem is, simply by putting more resources is not the way to solve the problem. Despite endless input of resources to the public healthcare system, you're not able to solve the problem of long queues outside hospitals. You're only making improvements in drips and drabs. Apart from solving the problem for public hospitals, we also need to turn to private healthcare as well. For private hospitals, the SAR government provides manpower, land, and other resources quite indirectly. For example, land premium is paid at a nominal rate, and for non-profit making private hospitals, so to speak, they enjoy tax breaks as well. When public hospitals are in dire straits, when grassroots suffer day and night the ailments while waiting to be treated, the private hospitals should chip in. They should not just sit on their hands. They should do their best to support public hospitals. The government proposes to expand PPPs to cover more specialties. I absolutely support that. In fact, we already have similar schemes. The GOPC PPP was introduced 8 years ago, and through all these years we have accumulated much experience. It's opportune to further expand the PPP to cover specialist outpatient clinics. We have cataract, glaucoma, colon cancer screening under these PPPs, but not SO or specialist outpatient services. The objective of public-private partnership programs is to foster collaboration and include more specialties. We're asking the government to procure healthcare services from the private sector. It may be even less costly than deploying resources into the public health care system to solve the problem. By doing so, we can shorten the waiting time, alleviate the pressure on public hospitals, and we can optimize the use of healthcare resources so that we have a more even distribution of healthcare resources between the public and private sector. I support the motion. Mr. Dennis Leung. Mr. President, I thank Mr. Edward Leung for moving the motion for us to discuss the healthcare issues in Hong Kong and for the government to consider introducing more options to solve the problem. We have long queues for public health care. This is an endless wait for patients. Since the establishment of the Hospital Authority, we have had a number of challenges such as an aging population and manpower shortage. I think the government should review the use of resources and review the role of the Department of Health and consider whether a more coordinated approach should be taken to oversee different services such as Chinese medicine and dental services to provide early treatment to needy patients. The Hospital Authority is like an independent kingdom. We have fat cats in the senior management. The emphasis is placed on management instead of frontline staff. They cannot retain manpower as there is a brain drain to the private sector, which contributes to the deterioration in the quality of services of the Hospital Authority. We don't have sufficient manpower in public hospitals to deal with the long queues. If we are to provide more subsidy, perhaps in the form of voucher schemes, to encourage patients to visit private clinics, this still cannot solve the problem. Rather, the government should review the overall situation. For example, for SOPCs, can ambulatory procedures be provided to shorten the waiting time for hospitals? When a patient is in need of a specialist, the patient should first go to a GOPC for a referral to be made to an SOPC, and the patient will need to wait for a long time for the first appointment at the specialist outpatient clinic. Early intervention and early treatment could help treat the illness. Perhaps if medication is provided at an early stage, the patient's condition will not deteriorate. The patient will not require chronic care. And more importantly, the patient will not have to suffer for a long time. The government's job is to monitor HA's performance by setting up indicators. Resources are provided, and yet we don't see whether our requests are exceeded. We should make sure resources are distributed evenly, and we should set work indicators or performance indicators to gauge the waiting time for specialist outpatient services at public hospitals. And a timetable should be drawn up to gauge its effectiveness. There are so many long-standing problems. The government should have stepped up its effort in promoting a healthy life. There should be standard working hours for all employees in Hong Kong so that they work for only 8 hours and they have work-life balance, so that they have sufficient rest and keep themselves healthy. That's the ultimate solution. I support the motion and all the amendments I so submit.
The last member to speak, Ms. Judy Chen. Thank you, President. In order for members of the public to live a happy life, health is a basic requirement. I thank Mr. Edward Leung for moving the original motion on shortening the waiting time for specialist outpatient services at public hospitals. It gives us a chance to reflect the public's views. That is, we need to have a holistic mechanism on cutting the specialist outpatient services waiting time. It has been a long-standing issue. The government has been increasing the resources allocated to the public healthcare system. Still, the public healthcare system has always been overburdened. Before the epidemic, according to the Department of Health, in year 2018, according to the Healthcare Manpower Survey, among the doctors in Hong Kong, some 45% of the services in public hospitals are caring for 90% of the population. The doctor to population ratio was 0.9 to 1,000. The situation has always been imbalanced. Patients requiring specialist services had to wait for years. It would delay their treatments and it also make it more likely for their situation to deteriorate. That will in turn cause further burden on doctors. It is a vicious cycle. With the aging population in Hong Kong, the demand for public healthcare services would only increase. To optimize the operation of the public healthcare system and enhance the general health situation in Hong Kong as a whole, we have to enhance medical and social collaboration as the primary healthcare level to alleviate the immense pressure on our healthcare system. I'm pleased to see that the Chief Executive has proposed to establish the Primary Healthcare Authority under the policy address and also the 3-year chronic disease co-care pilot scheme from year 2023. There will also be enhancements to the role played by Chinese medicine practitioner, and also the legislation will be amended so that physiotherapists and occupational therapists can receive a direct referral of patients under certain situations. This is in response to our long-time course. According to the figures in year 2021, according to health survey, some 2.1 million people in Hong Kong have illnesses diagnosed by Western medicine practitioners. A quarter of them are about the age of under the age of 65. Some 1.5 million people have illnesses like hypertension, lipodemia, cancer, asthma, and stroke. Now, the top 3 killers in Hong Kong are hypertension, lipodemia, and diabetes. Now, without a proper management, chronic disease can develop very quickly. Prevention is better than treatment. We have to enhance the development of primary healthcare network so that chronic patients in the community can receive risk assessments and also targeted care. And also we have to deploy community resources to manage the health of residents to alleviate the pressure on public hospitals. The government should also think of ways to alleviate the manpower situation in terms of the healthcare. Training of doctors take as long as 7 years. We need to continue training local doctors, but patients can't wait. In terms of increasing healthcare manpower, the government should take a more aggressive approach in attracting more non-locally trained doctors to practice in Hong Kong. President, we are all eager to see the enhancement of primary healthcare infrastructure in the community and also the admission of more talents to alleviate the shortage of healthcare manpower so that the primary healthcare system can be more robust. Thank you. Mr. Edward Leung, you may speak on the amendments.
Thank you. I would like to thank the 3 amenders to my original motion, and I also would like to thank 37 members who have spoken. They have covered different suggestions and different views, but there is a very clear conclusion. That is, well, the waiting time for specialist outpatient services. Mr. Leung, please come back to the amendments of the 2 members. First, I would like to thank Dr. David Lam for his amendment because he has proposed the idea of a primary healthcare system. Family doctors know their patients very well, and they can take care of cases related to rhinitis and dermatological diseases. You don't necessarily have to go to a specialist to seek treatment. So there is a need to establish primary healthcare systems centering on family doctors to enhance the capability of family doctors to handle cases. This will in turn shorten the waiting time for specialist outpatient clinics. In relation to Mr. Lee's amendment, that is the use of big data, well, there is actually a need for big data. Some of the DHCs would need new contracts, but we don't have sufficient data to monitor its operation. Neither do we know about the contract terms. Say, for example, how many cases are taken up by DHCs? So we need to review the operation of primary healthcare system. In order to create a synergy between the HA hospitals as well as the DHCs, we need data of the specialist outpatient clinics in order to analyze where the needs are. so that DHCs can provide more targeted services in order to help patients. This will also avoid the need for them to go back to the public hospital. Dr. Stephen Wong has talked about the functions of primary healthcare in prevention, triage, etc. We share the same goal. We need to avoid duplication of services used by members. We have mother and child health center, we have elderly daycare center, and we also have a student health programs. These organizations provide health check as well as health services. So to a certain extent, there is a duplication of service provided between these organizations and the DHC, so that their roles should be clarified. The DHCs, for DHC Express, the size is small and the services provided are limited. DHC Express should be developed into DHC so that they will be equipped to take care of rehabilitated patients, so that the patients don't have to go back to the public hospital. In the policy address, there is the proposal to establish the Primary Healthcare Authority. I support that. DHCs should take the lead in the development of primary healthcare system. They should work with service providers. If we operate DHCs well, then the system to use community healthcare as a backbone will be realized. So I support the amendments. I so submit.
Secretary for Health. Mr. President, members, I thank Mr. Edward Leung for moving the motion. For 37 other members to provide many useful suggestions and comments to the government. We will carefully collate and consider members' views, and as set out in the policy address, we're going to take forward a number of new initiatives. I just want to point out that Hong Kong's healthcare system has won the world acclaim, and in terms of number of indicators, we're in the leading position around the world. We have 2 medical schools of high caliber. For Hong Kong U Medical School, we ranked the 13th in terms of the global clinical practice in for the CUHK. It's also in the top 50 places. So if we are to make comparisons with other countries, I do hope that we don't criticize ourselves too much based on just a few indicators. When it comes to long waiting time at public hospitals, we need to reflect on a number of issues. Public health care is the backbone of our healthcare system. Close to 90% of patients receive services at public hospitals. These are not patients living in poverty. We do have patients with means, including the honorable members here, as I heard yesterday, using our public healthcare services. Because apart from providing affordable services, we also provide emergency services and treatment. If you have any emergency, you would visit an A&E unit. And the public hospitals in Hong Kong are tasked with training for local healthcare professionals. It is therefore essential that we maintain public health care services for the long-term sustainability. There are two major issues surrounding this long waiting time. One is demand and the other is supply. That accounts for the long waiting time. And I'd like to share my experience with you as a frontline doctor who have worked in the hospital for over 30 years. About a dozen years ago, when I was still working in a Queen Mary hospital, there was an elderly lady coming into the lift one afternoon, and she said with much emotions that you're the oldest doctor around in this hospital. I was quite surprised at the time. I wonder if she was criticizing me or otherwise. I think if this elderly lady comes back to the hospital 10 years down the road, she'd be even more surprised, because it's very rare for a public doctor to work in a public hospital all the way till retirement. 88% of doctors leaves the public healthcare system before reaching retirement age. And among them, 88% of them have left before they have been promoted to a medical consultant's grade. That means they will have left the system when they're still the associate consultants. For the highest attrition rate, according to statistics, most doctors leave before they reach the age of 40. So that's a grave concern. Is it because of the system, the work environment, or is it because of the mindset of new doctors? What does the new generation of doctors think in providing service in the public healthcare system? There is immense pressure on the public healthcare system. We need more health professionals to join us. For the rarest ones who stay on until they reach retirement, being consultants, they are mocked as dinosaurs. In this day and age, no doctor would stay on until they reach retirement in a public hospital. I'd like to take this opportunity to express my gratitude to doctors and other healthcare professionals who have stayed in public hospitals and helped fight the epidemic. There are so many reasons for a doctor to leave a public hospital. There is one reason to stay behind. That is the original intention of being a doctor. Now, when it comes to manpower at public hospitals, we have a lot of vacancies, but we don't have enough doctors to fill them. This is especially serious for the associate consultant grade, and the government has made a lot of efforts in replenishing the healthcare workforce. For example, our two medical schools, which enjoyed high acclaim globally, have increased the training places to 590 in total. Yet it's common refrain that it takes 13 years of training for a student to become a specialist doctor. So it's only a long-term solution. We also consider admitting non-locally trained health professionals to practice in Hong Kong, such as nurses and dentists, and the medical registration ordinance has been amended. And 47 doctors have joined to practice in Hong Kong under limited registration. The HA also has a number of retention measures, such as extension of retirement, extension of service after retirement. The so-called dinosaur doctors will stay in public hospitals after reaching retirement age. We also have a promotion prospect for the associate consultant grade. There are also more flexible measures for colleagues to choose to be locum doctors. We have 1,800 such locum professionals, 350 of them are doctors. We also actively consider requiring qualified, non-locally trained doctors and nurses to serve in public hospitals for a period of time. Especially in light of the relatively low ratio of doctors in public hospitals, we have to take certain measures. According to the manpower planning and projection for the healthcare sector in 2020, our work is due for completion. The results will be announced this year. Together with Hospital Authority, Department of Health, and also the Academy of Medicine in Hong Kong, we put forward some measures to increase training places. I turn to the next issue, and that is demand. Some say that we join the assembly line as soon as we're born, or we are flowing along a stream, and eventually we will reach the stop, that is the hospital. And that is why the HA adopts the strategy of narrowing down the upstream, collaborating downstream, and diverting midstream. Yesterday, in my opening remarks, I already explained the strategy. In order to implement these measures, we need to narrow down the upstream and collaborate at the downstream. This term of government is determined to take forward the development of primary health care. If we don't take this step, there will not be the next step. I'd like to illustrate with the example of the specialty of eye. Many members have turned to the waiting time for the specialty of eye to explain how long the waiting time is. I'd like to give you a more accurate picture. We triage patients. 1/3 of patients are priority 1 cases, so they are urgent cases. As for another 22% of patients, they are of priority 2 cases. So to be exact, 53% of patients will only need to wait for 1 to 8 weeks, belonging to the 2 categories for the first appointment. In 2021-22, the attendances for the specialty of eye was close to 130 or 140,000, and over 70,000 patients belong to priority 1 and 2 cases. For the remaining 47%, some 60,000 patients, they are in stable condition. They have milder symptoms, and I would say that if we have had a better primary healthcare system, many of these patients would have been treated at the upstream without having to be referred to the specialist. Another important figure is that public eye doctors account for only 30% of all eye doctors in Hong Kong. So we have 30% of eye doctors serving the majority of patients requiring treatment. They have a lot of difficulties, and once again, I'd like to express gratitude to these eye doctors providing services at public hospitals. The attrition rate for the specialty of eye is over 10%. That's the problem we need to face squarely. So, do we want to triage more patients to the private sector, or do we want to attract more public doctors to come back to the public hospitals and prevent a brain drain to the private sector? All in all, about Mr. Edward Leung's motion on shortening the waiting time for specialist outpatient services in public hospitals, it's just a tip of an iceberg. There are many deep-seated issues. For example, we need to promote primary health care. We need to optimize the use of private and public healthcare resources. We need to increase manpower and strengthen our healthcare infrastructure and make better use of technology. These are all suggestions put forward by members. The government will take forward the relevant initiatives. In revamping the healthcare system, the government cannot rely on its own. Rather, the government will take the lead. The government will show resolve and fortitude. And meanwhile, we need cooperation from the community and from patients as well. For healthcare professionals, they should uphold the professional ethics, and we don't want healthcare personnel to break the law. For patients, they have rights as well as obligations. They should cooperate with our healthcare staff in the treatment process. We should give greater support to healthcare personnel in our public healthcare system. We should acknowledge the contribution to our society. We're on the path of revamping the healthcare system in Hong Kong. In the 40th anniversary of the establishment of the Shenzhen Special Economic Zone, President Xi said that there is no end to reform, and we should continue to make reforms, and that is why our people should work with the government and continue to revamp the system.
And I'll call upon Dr. David Lam to move an amendment. President, I move my amendment. I propose the question to you that Dr. David Lam's amendment be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by majority of each of the two groups of members present. I declare the amendment passed. Mr. Lee Chun-keung, as Dr. David Lee's amendment has been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Mr. Lee Chun-keung's further amendment be passed. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by majority of each of the two groups of members present. I declare the amendment passed. Members have been informed that as Dr. Lam's amendment is passed, Mr. Stephen Wong will not move his amendment. Mr. Edward Leung, you have 1 minute 49 seconds. Once again, I'd like to thank members for participating in this debate, and I'd also like to thank practitioners in the public sector to stand by their post to serve the public. I'd like to thank the Secretary, Dr. Low, for promising to set a target in certain specialties to keep the waiting time to within 100 weeks. Well, it's within 2 years, there is still a chance for ailments to turn into serious illnesses. I do see that the Secretary himself has been very resolute in the fight against the epidemic. He has responded to public aspiration. We can see his determination. The task is daunting, but as President Xi said, that the road is bumpy. So we need to work harder. I'm sure that the Secretary will continue with his good work. We are your partners. We hope that under your leadership, we will say goodbye to long waiting time in Hong Kong. So lastly, I hope that you will all cast this important vote to shorten waiting time in for specialist services in public hospitals, so the patients don't have to worry about their ailments turning into serious cases. I think the question is that Mr. Leung's motion as amended by Dr. Lam and Mr. Lee Chun-keung be passed. Those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the motion as amended passed.
Motion on legislating on digital economy